Hi everyone, today we are going to be discussing about the overview of the upper limb, focusing on the clavicle. Shoulder, the proximal segment of the limb that overlaps parts of the trunk, thorax and back and lower lateral neck. The pectoral girdle, shoulder girdle, is a bony ring, incomplete posteriorly formed by the scapula and clavicle, and complete anteriorly by the mandibular of the sternum, part of the axial skeleton. The clavicle collarbone connects the upper limb to the trunk. Its medial half is convex anteriorly, and its sternal end is enlarged and triangular where it articulates with the mandibular of the sternum and the sternoclavicular joint. Its lateral half is concave anteriorly, and its acromial end is flat where it articulates with the acromion of the scapula and the acromioclavicular joint. These curvatures increase the resilience of the clavicle and gives it the appearance of an elongated capital S. The clavicle is subcutaneous and palpable throughout its length and is often used as a landmark for clinical procedures. Although it is designated as a long bone, the clavicle has no medullary marrow cavity and it consists of spongy tabecular bone with a shell of compact bone. Attachment. The superior surface of the clavicle is smooth, while the inferior surface is rough because of strong ligaments binding to the first rib and suspend the scapula from its acromial end. Conoidal tubercle gives attachment to the conoidal ligament, which is the medial part of the coracoclavicular ligament. The lateral part of the coracoclavicular ligament is the trapezoid line, which the trapezoid ligament attaches. The subclavian glove is the medial third site of attachment of the subclavius muscle. More medially is the impression for the costoclavicular ligament, a rough depressed oval area that gives attachment to the ligament binding the first rib to the clavicle, limiting the elevation of the shoulder. Clinical importance of the clavicle. The stout is movable and allows the scapula to move on the thoracic wall at the scapulothoracic joint, increasing the range of motion. Protects the important neurovascular bundle, the clavicle auxiliary canal, passage between the neck and arm. Transmits shock traumatic impact from the upper limb to the auxiliary skeleton.